Hi, everybody. My name is Catherine Sullivan DiCarlo. I am Vice President of Admissions and Marketing for Chapel Haven Schleifer Center. And we're really excited to offer this webinar tonight. We do find that anytime we offer a webinar around financial tips for our families and for our prospective families, we get a very enthusiastic response. So we're really lucky to have Andrew and Rebecca presenting for us tonight. Just a quick little bit about Chapel Haven. We're located in the Westville section of New Haven, and we are about to celebrate our 50th anniversary. So we've been serving adults since 1972, starting out on Chapel Street a long time ago. And our mission is to help adults with a variety of abilities become as independent as they can possibly be. So our youngest adult that we serve is 18. And we just figured out the other day that our oldest adult is now 68. So it's quite a span of 250 adults, autism, Down syndrome, developmental disabilities, Asperger's syndrome. And the key ingredient for everybody is everybody wants to have their own independent life. And so that's what we're all about. Just a quick note that if you're interested in learning more about Chapel Haven, we will be holding a couple of open houses coming up. We have been doing virtual open houses because of COVID and have found it to be very useful. So, interested families can log in and get a really nice overview. So the next one will be February 5th in 2022. And then we'll do an in-person open house in March 19th. So not too early to save your seat if you're interested. All right, so gives me great pleasure to introduce Andrew Comero, who we have worked with in the past, and I have found him to be a wonderful presenter with a lot of very good information about finance and how to make the most of your entitlements and your insurance. Andrew is a passionate advocate for autism awareness, and he is also a certified financial planner and a certified neurodiversity professional. And he is the head of planning across the spectrum. And so we're also extremely excited to welcome Rebecca Palazzo, who is Regional Sales Manager, Connecticut Medicare for Anthem. And poor Rebecca thought that this was actually happening at Chapel Haven. So she was driving to our campus when she realized what was going on, and she quickly turned around, but we're delighted to welcome her. So I'm going to turn this over to you, Andrew.
Oh, thank you so much. No, it's happy to be here. So I'm just going to share my screen. I think I got the right one. How's that?
It's starting. Let's see. There you go. Yeah.
Cool. So this presentation is actually going to be the first one on this particular topic. And we're going to start off, and it's called, again, the spectrum of healthcare. There's a little bit of a theme here, but we're going to walk through, let's say, kind of the stages of the healthcare. And, the fun part is going to be when Rebecca speaks, not me. And that's going to be when we're talking about what we find a lot of people, including myself, that I was not enough aware of. And that is a lot of our population is leaving a lot of money on the table or missing out on a lot of extra benefits that many times come at no cost when it comes to, insurance later. But before we got there, we wanted to just kind of like go along that journey really quick. Also with me is our insurance specialist, Robert. So when people inevitably have questions in the last part on, the Medicare, et cetera, it, can be directed to me, Robert. He'll also, I think, help out in the chat if he's able. So this should be a little bit different. I think I made it fun. I included a few funny memes, so we'll see how that goes, and hopefully informational as well.
So Andrew, we did have a question. I should have mentioned, we are recording the presentation and we will be sharing it through our YouTube channel. But we already do have someone asking if we would be distributing your PowerPoint after the show. So I mean, after the talk. So I don't know, Andrew, if that's possible, but if it is, we would be happy to do that.
Yep. And somebody said the Zoom isn't fitting the window. Is that everyone else?
Well, she said she said
Oh,
she
got it
fixed
now.
it.
Oh,
Yeah.
okay. Sorry. Yeah, no, all my information here is public. I would like to say that the highlight of the presentation and any PowerPoint is the speaker. So me and Rebecca. So hopefully you watch the YouTube video. But yeah, more than happy to share the PowerPoint. What's important is giving good information to families. If you sell it as a copyright for lots of money, donate some to Chapel Haven for me. Okay. Okay. So again, who we are, we've done some presentations before on helping, individuals, families, and employers, promote, pursue financial independence, enhance quality of lives. And a very important topic and a very timely topic is healthcare. And we call it healthcare because, I have this landscape and I'm looking at employer, private, Husky, 4 different types of Husky. Actually, there's more. Medicare, dual eligible. I'm not sure I have it all straight, and I'm the one presenting as an expert giving the presentation. So hopefully everyone learns a little bit of, everything. And the highlight is, again, the end. So we're going to start with, again, employer provided, private. The Husky, we'll talk about a little bit as a bit of a comparison. And then we kind of get to the fun stuff. And I call it fun because this is the part when I was talking to Catherine, I'm like, I want to do a presentation about this. She's like, I didn't know about that either. So here we go. I think most people know that you can get insurance through an employer. And really most of America's health insurance system is really designed around lots of employer provided healthcare. It has moved a bit more over the years to being a bit more of the individual market, which is the part we'll get to next. A thing I really want to highlight is cost has gone up very much dramatically over recent years. And if you're a parent and you're attending this webinar, and if you're an individual under the age of 26, you're on your parents' insurance. So what do you care how much they're paying? So even if you are, I'm talking to the parents, it's worth evaluating if it makes sense to keep them on your plan. It's just because my wife tells me this when I do something stupid, just because I can do something doesn't mean I should do something. So just because, they can stay on your health insurance doesn't mean they should. What if they're eligible for Medicaid and Medicare? There might be other options. Regardless, it all depends. And many people are still within open enrollment. And if they weren't, well, I was here last year. I'll probably be around next year. So, there's always another opportunity to look at what an employer offers you and really have someone look at it from what are your needs. Sometimes it makes sense for if there's 2 parents in a household and 2 employers for them to each have their own plan. It's really all dependent and it's really changing. The biggest takeaway that I want to give is just because an employer provides insurance and just because you have a dependent under the age of 26 does not necessarily mean that it's best to keep them on that insurance. And especially if they're potentially eligible for Medicaid or Medicare, probably does not make sense if it's even possible to have them on that insurance. And I know this is a really simple topic. There will be an exam at the end, but if you have questions, feel free to put them in the chat. Robert or someone will try to answer them. Maybe we will, maybe we won't. Okay. So going to talk a little bit about the private insurance, and that is the Affordable Care Act. So one of the reasons that employer provided health insurance, in my opinion and experience, has been the major, driver of our health system is the fact of the insurability. Previously, when it came to, private insurance, there had to be some evidence of insurability. You had to be underwritten, like life insurance. They had to make sure only healthy people could buy insurance. Well, that's not the case anymore. And in Connecticut, there are two options as far as private insurance and what we call the exchange. It is also known as Access Health Connecticut. And Access Health Connecticut is, we actually are appointed to be able to help walk people through it. They're in such desperate need of brokers. We almost debated flying Robert out from Arizona to come help during an enrollment event. But in all seriousness, it's something that I find not enough people are looking at as an option. I'm recommending more and more, especially to small group employers, even myself as an employer. What we're not having the group health insurance anymore. We're able to offer somebody can go and help buy a policy on the exchange, get something that suits them. This is now assets do not count. It's only your income. And this is, please don't hold me to it, but if you're a single individual and you make $30,000 or under a year, you're probably going to get a basic health insurance plan for free after the tax subsidies. If you're curious how all that works, when you find out, please tell me. No, in all seriousness, Robert can help with that if anyone has questions. It is annual enrollment. I started trying to renew my plan on the exchange last night, and the website was so frustrating, I gave up, and I can sell it to myself. So if you need help, please reach out. Something very important to note is if families on here do have, younger individuals on their healthcare plan, just make sure to look at what might be offered and what might be excluded. What that means is some therapies such as ABA don't have to be covered by individual plans in Connecticut. So some Anthem or Connecticut plans will cover that on the exchange and some won't. So it is pretty important to look into the details. Another important thing when it comes to the exchange is you see these deductibles of thousands of dollars. And well, that sounds like a lot. And it is. But when you look into it a bit more, many times we find that, well, the deductible very rarely applies. So it doesn't apply to the doctor visits, therapy, speech therapy, chiropractor, MRIs, urgent care, but it'll apply in certain other situations. So it is important that not all high deductible plans on the exchange are created equal. So, and again, we're moving through this spectrum a little quickly so we can spend the most time on the fun part towards the end, but feel free to ask questions in the chat along the way. So in Connecticut, we have Husky A, B, C, and D, Medicaid. There are actually even more Huskies than this. And if you think it's confusing, it is. There are many different options to cover many different populations. It's extremely confusing, and there is no one size fits all. Going to make a general statement that's not always true, but generally, individuals with disabilities and on SSI will want to be on Husky C over 19. So that is what we should see. That's what most of the individuals, when they're a bit older, will be on. And again, that's Husky C. So let's start with Husky A. Husky A for parents, caregivers, pregnant women, and children under the age of 19. So it's important to have a plan. So if you or a family member is 17, 18, they are on Husky A, and it is important to make sure to evaluate the options. They may need to apply for SSI and look to see about getting them, for example, on Husky C if they're eligible. Just don't wait until it's too late. If anyone has applied for any of these before, we know how long Department of Social Services can take to answer anyone for anything. So, it doesn't hurt to start thinking about it a bit too early. It's not a bad thing that you're losing Husky A. Could even potentially be a good thing. Husky B. Now, all of these are so similar. Catherine said, I think all these slides are the same, but they are confusing. They're not quite all the same. Husky B is different than the rest of the Huskies. One important thing for a lot of families is Husky B does not cover ABA. And somebody asked in the chat, Husky, yes, Husky specifically to Connecticut, it would be Medi-Cal in California. We decided that healthcare and Medicaid weren't confusing enough, so we wanted to give states the ability to name all their own. The dual eligible part, Christine, in the chat, the fun part, the part I hope you came for, that's going to be more or less, applicable. The plans will be different everywhere as well. And every state has their own version, like California has Medi-Cal. Husky B is a lot less popular than it used to be. A large part of it is many families who were stuck in between healthcare being unaffordable but making too much for some of the other options would go on the Children's Health Insurance Program, also CHIP. We find that given the subsidies from the exchange, there's 20,000 individuals in Connecticut on Husky B. And a big detractor for many families is it does not cover ABA therapy, which is very expensive. It probably never will. So not really seeing this as much as an option. Husky C. So this is the one where if somebody is on SSI or if they've transitioned to SSDI and they're considered disabled, then they're on Husky C. In Connecticut, if you want to know whether you're on Husky C or not, if you've been told that you can't have more than $1,600 in a bank account, you're on Husky C. So that is one way to almost certainly know. SSI in Connecticut is $2,000. In most other states, it's $2,000. But Connecticut's so broke that we really try to capture that extra $400 from everyone. So if you've been told that you have, a $1,600 and even very likely a $2,000 limit for benefits, then you're more likely on Husky C. This is the gateway to lots of benefits and resources. It's for DDS funding. It's for the autism waiver. It is one of the main sources of support, also beyond health insurance for many individuals. So we find in our planning that Husky C is very important. Side note, there is a version of Husky C if an individual is working. In Connecticut, if you're working, because Chapel Haven has helped get you an awesome job and living in a very cool apartment, you can make up to $75,000 a year and you can keep your Husky C. You can have $2 million or more in a retirement account and keep your Husky C. There's no $1,600 limit in a retirement account. So, and I've done earlier this year, did one on working disability in Connecticut, and that's where Husky C can apply as well. So last but not least, there is Husky D. So this is Medicaid for the lowest income populations, anyone between 16 to 65 who does not meet the requirements for Husky A. There are income limits, but no asset limits. So something I want to mention, because I just have a feeling at least one person who's listening has had this happen or will have it happen. You can't have Medicare and Husky D. So what that means is if somebody is receiving SSI, they're getting money, and a parent retires. What happens a few years later is that individual will be eligible for Medicare, which is the fun stuff that we're about to get into. And you're like, what could be more fun than this? And my answer is probably anything. So that's why we're moving in that direction. So we do find that it can be a source of confusion. Many people don't know what they have, and that's okay. Pretty sure that they try to make it confusing so people just give up. And so if you're unsure, we do a lot of helping people figure out, what they have, what they might need, and the best options for them. So just keep in mind that, again, if you're a person with a disability, generally speaking, you want to be on Husky C. If you're working with a disability, Husky C. But being on any of the others is okay. There are reasons to be on Husky D versus Husky C, etc. And it's all dependent on the individual. Medicare. So I've noticed the billboards driving. It's Medicare annual enrollment season. So a lot of parents, individuals on this call, they're eligible for Medicare. What many people don't know is that if somebody with a disability who had the disability prior to the age of 22, so let's say they're on SSI and Medicaid, when a parent retires, passes away, becomes disabled, 24 months after that, that individual starts getting Medicare. And Catherine asked a good question. Can you have Husky C and Medicare? And the answer is yes. And that is what we call dual eligible. So, and that's the goal, and that's the highlight of the presentation. An individual can also be eligible for Medicare off their own work record. So generally speaking, we'll ask an individual how much money they're getting per month, because if they're getting more than the SSI amount, then if they're not eligible for Medicare, they will be soon. We find in the population that we serve, almost all individuals will eventually be eligible for Medicare, potentially Medicaid, which should be the goal, assuming they need those services and support. And they should be on what's called the DAC. It is more like traditional Social Security. So, and that is based off the parent's work record. So let me do a little comparison, an overview. There is a lot of overlap. So Medicare is the same, more or less. Federal. Medicaid, we decided to make very confusing by calling it different things in all the different states, but they can both help people with disabilities. They both may offer prescription drug coverages. They may offer lots of other coverages. So again, most people, when they think of, Medicare, they think of, oh, good. There's, more doctors. Lots of doctors take Medicare. Not a lot of doctors take Medicaid. And usually that's something that people like. It provides better access to healthcare. And the nice thing too is in the state of Connecticut, there's many programs that can help lower the cost of, these Medicare supplements. And for the rest,
half done, or is it done?
No, they're done.
So I don't know what that person looks like. They were baking something. So I hope it's good, or cookies, and they, send us some.
May I ask a question?
Are you going to ship us some cookies?
Question, what are you going to ask?
Yeah.
How does Husky D Medicaid differ from Mass Health?
That they're similar. Mass Health is like Husky, so there's different types and different programs. So the long answer is no. It's only a long answer, so it depends. They can be similar. I guess I'd look at it that way on the surface.
Andrew, we also have a question.
Yes.
Can you clarify how someone under the age of 65 can get on Medicare? And it looks like Rebecca answered that.
Yes.
Okay.
So, yep. So again, to go over that part, and I'm just going to go over that slide, and that's the highlight. Under the age of 65, the majority of the population across all states is going to be eligible for traditional Medicare after 24 months on Social Security disability, or when off what's called the DAC, Disabled Adult Child Benefit. So that is 2 years after a parent passes away, becomes disabled, or retires. They'll be eligible for both.
I'm sorry, I have another question, sir. Andrew.
Yep.
My question is, how can I tell whether I qualify for this Husky Medicaid?
It's a bit individualized. Robert can type his email in the chat, and we could help answer that individually if you'd like afterwards.
Yeah.
Okay.
Thank you very much.
Rebecca, your turn.
All right, thanks, Andrew. Can everybody hear me okay? I just want to confirm you can hear me. All right, sounds good. So just to make Medicare just as confusing as Medicaid, there's also Medicare A, B, C, D, A, G, N. There's tons of letters when it comes to Medicare, and they all mean different things. Just like for Medicaid, they all mean different things. So if they didn't want to make life more confusing for you, it's going to be just as confusing. So dual eligible is a term when you qualify for both Medicaid and Medicare at the same time. However, they've also opened up something called the Medicare Savings Program, where if you don't qualify for Medicare, or I'm sorry, if you don't qualify for Medicaid because your income levels or assets are too high, you can still qualify for a dual eligible plan by being a qualified Medicare beneficiary, and you would apply through the Medicare Savings Program through Social Security. And the reason I bring that up is because Connecticut is very, very generous when it comes to income limits for the Medicare Savings Program, and they don't look at your assets as well. So you could have that $2 million in that retirement account and still qualify for a dual eligible plan through the Medicare Savings Program. So if you file your taxes single and you're single and you make under $2,265 a month, or as a couple, you make under $3,064 a month, that wouldn't make you eligible for Medicaid, but it would make you eligible for a qualified Medicare beneficiary or QMB status, and it lets you enroll in a dual special needs plan or a dual eligible plan. The reason we go over this is a lot of people think by having Medicare Part A and Part B, as well as a Medicaid gray card, they're good. Their copays are covered. They don't have to pay for their Part B premium, and they can go see the doctors on the plan that they can go see any doctor that accepts Medicare, and all their copays are covered. And they think, oh, well, that's good. What else do I need? There's tons of extra benefits that you'd be leaving on the table by just staying with a Medicare blue and white card, as red, white, and blue card, as well as a Connecticut gray card. You're missing tons of extra benefits that are offered to you at no extra cost just by being eligible for both Medicare, a gray card, and or a qualified Medicare beneficiary. Like I said, it's no extra cost for you. So to be eligible for a dual special needs plan, it's called D-SNP, dual special needs, or dual eligible, tons of names for the same type of plan. You would have to have Medicare Part A and Part B. And a dual special needs plan is called a Medicare Advantage plan, which is a Part C plan. So like I said, there's tons of different names for all these Medicare plans. A Part C plan or Medicare Advantage, it just combines your Part A for Medicare, which is your hospital, right? It combines your Part B for Medicare, which is your doctor network, and it combines your Part D, as in dog, for Medicare, which is your prescription drug plan. And all of that wraps up into a Medicare C plan or a Medicare Advantage plan. And having that gray card or qualified Medicare beneficiary status as QMB would give you a dual eligible status plan for tons of extra benefits. Go ahead, Andrew, to the next slide. So some things that are offered in these dual special needs plans that you're not going to get traditionally on just a red, white, and blue Medicare card and a gray card would be dental insurance. So if you're going to pay for extra dental on the side, there's no need. You should look into, call Robert, see if you qualify for some of these plans, and you can get dental insurance. It's not separate insurance, but it's dental benefits embedded into the plan that you just qualify for by having that red, white, and blue card, that gray card, or that QMB status. And I'm going to keep saying that over the presentation because those three things are important. You have to have that red, white, and blue Medicare card, and you either have to have that Connecticut gray card, or you have to have the qualified Medicare beneficiary or QMB status. So you can get dental benefits like $0 on your cleanings, x-rays, exams. So all your preventative care dental is covered at no cost. And then different carriers give you different allowances for plans. So you could have anywhere from 1,000 to 2,000 benefits or more on comprehensive dental services. So you could get root canals with that, which I hope you don't need one because I hear those are painful. You can get dentures, bridges, implants, cavities filled, caps on your teeth, whatever you need. A lot of times different carriers will cover different parts of dental procedures, and it comes out of that allowance that they give you. That allowance can either come quarterly, biannually, or annually. So there's tons of options for dental insurance just embedded into those plans. Along with that, it's also vision benefits. So you don't need to pay for vision insurance on the side. You don't need to necessarily pay for glasses and contacts on the side. So even if you have a low prescription, you can still get glasses. You'd get an allowance every year for glasses and contacts, anywhere from $100 to $350 allowance for glasses and contacts. And there's tons of different places you can go to get them, depending on the carrier that you would enroll in, would let you know which places you can go and get the glasses that you want. So you no longer have to go and pay for glasses out of pocket. As long as you have that red, white, and blue card, that gray card, and or the qualified Medicare beneficiary, you can enroll in one of the plans that give you these benefits. Tons of other benefits that you can have embedded in the plans. And I'm just going to stop because Christine has a great question. Do these plans require you to use providers in the network like an HMO, or can you select a doctor or dentist? Great question. So an HMO plan or a health maintenance organization is an insurance plan where you would have to stay within the provider network, and your preventative care doctor or primary care doctor would give you referrals to different doctors in the network for any services that they cannot help you with. There's also plans called a PPO plan, and that allows you to go in and out of your provider network. So because you're on a plan that's lower income, you still wouldn't have to pay for any services if you go in or out of network when you're on a PPO plan. So there's both HMOs and PPOs. So one plan will require you to stay in network, and another one would require you or allow you to go in or out of network or in and out of state, depending on which plan that is. So we always want to look at your doctors. We always want to look at your needs and see which plan is the best for you. So I highly recommend, if one of these plans is appealing for you, or you know you have that red, white, and blue card and that gray card and you have nothing else, or you know your income falls within that limits for the qualified Medicare beneficiary, send Robert an email or give him a call, because he'll be able to go through your doctors, go through your prescriptions, see what needs you have. Maybe you do travel a little bit and you're driving around or you're going to visit somewhere somebody else and you just want to make sure you still have coverage elsewhere and not just in the state or not just in with a specific Hartford Healthcare or Yale Healthcare or any of the other provider groups, Robert can look at your needs and see if an HMO plan or a PPO plan would fit your needs. So it doesn't necessarily have to stay within the provider network, depending on the plan that you get. So not only is there dental coverage, not only is there vision coverage, there's also hearing aid coverage. So you can get a hearing aid exam at $0 cost. And you can get an allowance for hearing aids anywhere from $1,000 and up for hearing aids. Every different carrier will use different providers for hearing, but you can get your hearing aid covered. You can get over-the-counter benefits. So you'll get a quarterly amount for over-the-counter. That's what is over-the-counter. You can go into a Walmart, a CVS, a Walgreens, any of your drugstores that you go into, depending on the plan that you're on, and you get a quarterly allowance for any vitamins, any Depends, any toothbrushes, toothpaste, dental floss, Band-Aid, anything that you can buy over the counter at the pharmacy tends to be covered on the over-the-counter benefits. They're pretty generous on the allowances and they're pretty generous on what's covered. So you can use that quarterly allowance to pay for things that you may need that are over-the-counter benefits. You can do shoe insoles there a lot of the time. You can get different things to help with mobility around your house. So if this is something where you need, these benefits are covered for you, just embedded in the plans by having the gray card and the red, white, and blue card. There's also a personal emergency response system. So if you don't know what that means, which I'd be surprised if you did, and let me get my little demo unit right here so I can show you what it looks like. A PERS is the help, I've fallen and I can't get up button. Those are embedded in the plans. So they're usually a monthly cost to have them. On a lot of the plans, that monthly cost is covered for you. So it's this little unit, it goes right on your neck. And it's magnetic, so it's easy to pull across if you have a grandchild that is going to pull it. I have a 1-year-old son. He breaks every necklace that I wear. So you're not going to get strangled on it because it will come right across. It sits right here on your chest. You can press this little button and somebody is going to be on the other line. There's a microphone and a speaker. It picks up all the cell towers, so not just Verizon and AT&T or one or the other. It picks up every single cell tower across the country. There's GPS enabled in it, so they can see where you are in case you're lost or in case somebody is looking for you. And all you have to do is press the button, and someone will be there 24 hours a day, 7 days a week on the other line for you, right here. And it's not just for emergencies. 75% of the calls that get pressed by these personal emergency response buttons are not an emergency. And maybe this is Anthem specific, but I do know there's a whole personal side to it. They don't have a call limit where they'll only talk to you for 2 minutes. They won't do that. If you have a question on a commercial that you have, you can press the button and someone will be there to help you. If you want to learn how to use a computer, if you need help learning how to find a cooking class or something that you have a question on, just press the button. If it's the middle of the night and you're sad and you don't want to bother somebody in your family and you're depressed and there's a lot going on in the world and you just need someone there to talk to, just press this button and someone will be on the other line to help you. One of the questions that Catherine has is healthy foods. So Medicare Advantage dual special needs plans are now offering more benefits that aren't traditionally in insurance plans. They're going to give you transportation. So you'll have different transportation rides to and from healthcare doctors if you can't get help. Oh, that is a slide. Sorry, I wasn't sure. You can get healthy food. So some healthy food, you can get a grocery card. So it's a monthly allowance for you to go to the grocery store and buy groceries with. You can get service dog support. You can get personal home helper support. You can get pest control. If your house is infested in pets, you can pick pest control and you can have different benefits. So all of our different carriers offer all different benefits. So Robert can walk you through what you need and make sure that the plan fits your needs. And that's what he's here for. He's here to walk you through, take an intake of everything for you. What are your doctors? What are your medications? What's important to you? Do you need one of these purge buttons? Do you need transportation benefits? Do you want more over-the-counter benefits because you take a lot of vitamins that aren't covered under your prescription plan? What is it that you need in a health insurance plan and in general? And Robert's going to find the best option for you and get you health enrolled in that. The one last benefit we haven't gone over is Silver Sneakers gym membership. In all of the plans, there's a gym membership. With Anthem, we use Silver Sneakers. I know other carriers use different gym memberships. So your gym membership is included. So if you want to get back out there, get to the gym, exercise, that's included in the plan. If you don't want to go to the gym because you're nervous about the pandemic and you're not ready to be back out there fully in the gym, which I do see a lot, they have classes on demand and live classes virtually that you can join in just to get your body moving and get those wiggles out, because I know it's been a long couple years in the pandemic. So all of this is just included for you. You don't have to pay anything extra for that. You just have to have that red, white, and blue Medicare card, that gray card, or be a qualified Medicare beneficiary, and you can qualify for all these extra benefits at no cost to you. It's giving
Rebecca,
you benefits that you need. Yeah.
as far as Silver Sneakers, is there like an age? Like, do you have to be 65 or older? Long as you just, long as you have Medicare or Medicaid? Okay.
As long as you're enrolled in that plan, as long as you're enrolled in the plan that offers that benefit, then you have access to it.
Okay.
And we have Lena has her hand up. Lena, do you want to unmute and ask a question?
Okay.
Yes, actually, I have two questions. One is that I have my daughter, she's a special child, and it's for me that, you know, I'm disabled. Then I had the problem with transportation because sometimes I had to go from my house, I don't drive, to my daughter's school, and then the school pick it up and bring it to the appointments. Is that transportation is allowed in the plan?
So the transportation is it's a 60-mile limit. So they'll pick you up if you're going down to, you just have to specify when you make that appointment that I'm here to pick up my daughter and bring her to the appointment. Are you the person that would be enrolled in the plan, or would your daughter be enrolled in the plan? Or both?
Well, she's going, yeah, both, because she's going to be 7, you know, we both, yes.
So if the doctor's appointment, it depends, because if it's your doctor's appointment, they would go to your house to pick you up. They necessarily may not be able to pick your daughter up from school if it's not her appointment. So it just kind of depends on the situation, if she's not the one enrolled in the plan. So if it's just you enrolled in the plan, she would have to be at your house with you.
Yeah, no, it's just for my daughter's appointments.
Okay. If she's enrolled in the plan, then yes, they would pick her up at school to bring her to a
That would be wonderful. Thank you. I have another question. You know, my daughter, you know, she's a special child. We have a service dog for her. Is anything about the service dog? Because you just mentioned something about that.
Yeah, so it depends on what plan you're on. And I can't go too into detail on the exact amounts of benefits, just because of the way there's a lot of regulation around what can be said and what can't be said, depending on different scope of appointments that we would need. So what I can let you know is one of the plans that Anthem offers service dog support. It's a yearly allowance. I can't give you the full yearly allowance because I can't go too into detail on all the benefits. But it is a yearly allowance, and feel free to email Robert. He'll be able to go over in detail more, but there's tons of different things you can get for the dog, between leashes and beds, flea and tick medicine, treats, food, grooming things. There's a whole list of what you can get. So I highly, highly, highly recommend you send Robert an email, set up some time with him. It costs nothing for you just to talk through these options. And he'll see if your daughter can qualify for the plan and can go over all the benefits that are offered on the plan.
Rebecca,
Thank you so much.
my son has an emotional support cat. do they do anything for that, or is it just service dogs?
As of right now, it's just service dog, but they're looking it's service dog and a doctor's note. So it would have to be like a certified service dog or a certified emotional support dog. I believe emotional support dogs may be on a case-by-case basis. I can double check and Robert can let you know. We can triple check on that for you.
This is a cat. It's not a
Typically a
dog.
service dog.
Yeah, it's a cat.
I would have to double check because it's listed as a service dog support. But I can definitely double check and Robert can get back to you on that. So if you just want to send him a quick email, he'll get back to you on that.
I'm gonna probably make an appointment.
Okay.
Awesome.
So where are we in the presentation, Andrew?
I mean, we're at the end. Oh, one thing I
Okay.
want to
Okay.
mention too
Yeah.
is for all of the parents here, it is also your Medicare open enrollment. So if you are asking, well, why don't I have all these things too? Well, some of them are definitely very unique to dual special needs plans. However, Robert, Rebecca, can help. So if can help anyone who's eligible for Medicare pick the right supplements that may or may not have all of these. So, and I see some familiar faces here, and I won't call out names, but I know some of you are over 65. So, not Catherine, of course. Not by
Watch
30
it.
years or so. No,
Watch it.
you're only halfway there. So, but feel free to reach out to Robert for, again, yourself as well, not just the individual. And can help look at, the household as a whole as well.
Let's go to Linda and David K. They have put a question in the chat. When an adult child with a disability, collects Social Security benefits under the parent's record and then loses SSI, did they also lose Medicaid and have to reapply?
Say the beginning of the I'll answer that and then the second one.
Okay.
No, so actually, Linda, this is the perfect example to the reason we are doing this exact presentation. It is because the individual, they will lose SSI, but they'll get traditional Medicare, traditional Social Security, also called the Disabled Adult Child Benefit. And assuming that they still meet the qualifications for Husky C, now they may be notified that they have to leave Husky D, but they'll be on Husky C. That is when they become eligible for all these dual eligible special needs plans to take advantage of the Medicaid and the Medicare. There was also a great question I want to answer on how does planning across spectrum work, and is there a fee to work with Robert? And there is no charge to help, but if it sounds too good to be true, let me just explain why. And so how can, a company offer more benefits than somebody might be getting otherwise? Yeah. And all you have to do is come to the table with the assumption that the government is very slow, inefficient, and they waste lots of money. So what they do is they give companies like Anthem, let's say $1,000 a month to provide benefits and healthcare, et cetera. And Rebecca, correct me if I'm speaking completely off base, although you'd probably prefer not to comment at all. But they're giving $1,000 a month, and Anthem saying, well, we're going to be efficient. We're going to use, technology or et cetera. We're going to offer all these benefits. We're going to be innovative, right? And so Anthem saying for that $1,000 a month, we want to give you more bang for your buck. We're going to compete with WellCare, United Healthcare, et cetera. And the nice part is whether you call United Healthcare, Anthem directly, whether you call us or Robert or a billboard aside, insurance is all regulated. It's all built into the price. So for example, Robert or us are paid if you select an insurance plan. And our goal is to help you get the right insurance plan. It should be all no cost. There's no charge to you. and the insurance companies, that's built into their pricing directly. So if it sounds too good to be true.
Most of the way.
Huh?
I'm going to jump in just a little bit. A little bit. So it's somewhat true, somewhat a little not true. I mean, yes and no. The reason why we offer all these extra benefits, CMS, or Centers for Medicaid Services, did a campaign called Healthy People 2030, where we surveyed across the country, or where they surveyed across the country, the social determinants of health, or what attributes to people's health. So what are the conditions to the houses that they live in? How do they get to care? What care is near them? Do they have food? Do they have access to healthy food? Do they have running water, etc.? So they did a campaign across the country to see what the conditions that people live in. We then partnered, us as Anthem has partnered with CMS, and other carriers are starting to partner along with us to offer these benefits that aren't traditionally in health insurance companies to our low income and or older members, because that's where we were seeing a lot of these conditions that we're attributing to poor health because of where they live and because of the factors that they live in. And we wanted to be able to give benefits that aren't traditionally in a plan to help members at no extra cost to them. So the reason why it's no cost for you guys to work with Andrew or Robert, and the reason why I always recommend work with somebody local, work with experts like Andrew and Robert, because they're going to be able to offer tons of different carriers and plans, because Anthem's not going to fit with everyone, but United isn't going to fit with everyone, and other carriers aren't going to fit with everyone. It's not supposed to be that way. We're here to offer different options for you, and depending on what your needs are is depending on the plan that they would recommend you going with. So the reason why I always recommend you working with somebody like Andrew and Robert, and with them, they're great, by the way, is because they'll be able to offer all different benefits of different carriers for you. Whereas you just called into a billboard, they're only going to be able to offer the plans that are on that billboard. They're not going to be able to shop around and show you all your different options. The reason why it's no cost to you is because they are contracted with us, and we pay them on your behalf. So you don't have to pay them for their services when it comes to Medicare, because they shouldn't be charging you anything. If it is, it's illegal. So you got to let us know. I'm just kidding. They're not going to charge you anything. But we pay them on your behalf because you shouldn't have to pay for anyone's service to make sure you have the right benefits offered to you.
I got a question. Is there any co-pays in any of these insurance plans? No.
Not if you have a gray card and or
Okay.
QMB status. These dual eligible plans, there's no cost for any medical services for you.
And so because my son has Medicare and Medicaid C, the reason why I didn't jump on it when I found out is I was afraid it wasn't going to cover. I didn't know what was going to happen to his Medicaid C, because he gets service.
Yeah, his Medicaid. So what happens with that is Medicare becomes primary when it comes to healthcare. So if he has certain services, you just would always want to check the doctors to make sure they're in network. So he still has all the services offered under C. It's just that when it comes to medical care, Medicare becomes primary and Husky C becomes secondary. So they're going to bill Medicare first, and then Husky C or Medicaid is going to cover all the rest of the copays.
I mean,
and then they would still have their services.
As far as the services, he's on the waiver program.
Sherry,
Yeah.
I knew. Hi, we know each other. We have other clients on the autism waiver program. Husky C, dual eligible. That's no issues. What it was designed for.
I just wanted to clarify that before I get into it with him.
So feel free to shoot us an email. So
I will.
Happy to help you.
We have a question from Connie. Some of our Chapel Haven families may remember Connie. So Connie wants to know, if someone has QMB, what is the bank account maximum?
That's a great question. There's no asset limit, or your bank account's not even looked at. It's only looked at what your taxable income per month is. And as a couple, if your income is $3,064 or less, then you would qualify, or somebody who's single or files their taxes by themselves would be $2,265 or less. So they're not going to look at your assets, and they're not going to look at your bank account.
I have
She's
a
all-
question.
Sorry, I'm sorry. She's also asking what is the hospital coverage for QMB?
And if people could type questions in the chat if possible to make it easier.
Yeah, I want to make sure we get to everyone's questions. So
The hospital coverage on QMB, so QMB goes along with Medicare. So if you have Medicaid, you don't have to be on Medicare Advantage plan. But if you have QMB status, you would need to be on a Medicare Advantage plan. Hospital coverage is covered at $0 cost because all of your copays are covered at $0 cost because Medicare would pick up your copays and Medicaid would pick up the remainder. So there'd be no cost for hospital coverage with QMB status if you're on a Medicare Advantage plan.
if we can ask everybody to stay muted, please, because we are picking up some household noise here. Who else has a question?
QMB stands for Qualified Medicare Beneficiary.
Mhm. Great. Other questions? You can put them in the chat.
Okay, can we say verbally? Can I ask you a question?
Mm-hmm.
Yes. I have a son who has Medicare as well as Mass Health, which is Medicaid. I understand that Medicare is national and Medicaid is partly federal, partly state. So if he moved from Massachusetts to Florida or Texas, could he still get could he take his Medicaid with him? Could he, even if, say, Massachusetts may put some extra money in it, I'm not sure the differences of states, but does he have to apply for Medicaid again in a different?
So that is, and again, your situation is a bit complicated with a lot of depends. It would probably take us, half an hour or so on a phone call at a minimum to help figure that out. It would be really hard to answer without asking a lot of personal information, but we're happy to help if you want to reach out.
Sure. And how can I do that? Let me see.
And Catherine, will you shoot the information to everyone who registered as well in an email?
Yes. Mhm.
So
yeah. I have to say, I'm really amazed at all of the things you can get paid for that maybe people don't know about, like dental and service dog and healthy eating and vision, a lot of stuff.
Yeah.
Anyone else have a question?
Yes, I have another question. I'm sorry. What about pre-existing conditions?
What about pre-existing conditions? Is that your question?
Yes.
Oops, Rebecca, you're muted.
I'm on mute. Sorry, guys. There's no denials for pre-existing conditions. That was something that the Affordable Care Act on under 65 kind of went away with, and then there's no denials for pre-existing conditions on Medicare.
You asked for me how I get the gray card.
Anybody else?
I have a question.
Oh, Miss Connie.
Wondering with the QMB, that's what my brother has, and if he goes to the hospital, he does not have Advantage plan. He just has QMB. What is he responsible for?
He shouldn't be responsible. He shouldn't be responsible for anything because it's illegal to balance bill somebody in the state of Connecticut that has Medicaid or QMB. So balance bill would mean whatever Medicare doesn't cover, the member would be responsible. So it's illegal to balance bill a QMB status or Medicaid in the state of Connecticut. So he shouldn't be responsible for anything. But I do recommend just looking at Medicare Advantage plans for him, just because there's tons of benefits that he's just that he misses out on just by not being enrolled in one, and it's no cost to him. If he doesn't like it, he can always disenroll and go back to original Medicare.
He won't do it. He won't look at anything, nothing. Nope. I just wanted to make sure that
sad.
covered
Yeah,
hospital.
no, he won't. He shouldn't
Thank
get.
you.
He won't get balance billed. It's illegal.
Thank you very much. I'll sleep better tonight.
Do you
I have
guys, Andrew
another
and
question.
Rebecca, do you guys find that parents don't ask about all these other goodies because they just don't know about them, or what do you find?
I mean, I would say as a financial planner who's given lots of topics, and this is the area that we work with, I'm still learning about new things that are being offered because a lot of them are, new every year. I think many families too have fought, again, a long time. I mean, we had a couple people on this call who are eligible for more and, too afraid to take it, right? Because of how confusing the system is. So, we find that that's exactly why we want to do this, that most people have no idea that, this is an option. And it's something where, you can get more for, well, not less, but you can get more. So.
Great.
Transportation.
Yeah, I'd like to just add too that I'm Robert. That we working with the population that we work with all the time. We find that most of the time people have benefits that they're not even aware that they have, or they got automatically enrolled into something, and so they have a prescription drug plan, right? And they thought that that was their Medicare Advantage, and so after speaking to someone else, they learned that that was just the auto-enrolled system. And they were leaving all of these extra benefits on the table, like Andrew mentioned. And so just to do a simple explore what you're eligible for, a lot of times we found as, other people, that just helps open and relieve a lot of stress, because when some of those extra benefits are offered, it really helps. Like Rebecca mentioned, the population that the dual special needs plans are specifically designed to help are the ones that most need that help, and to help them live their healthier lives. That's why the plans are put in place, and not just the special needs plans, but just Medicare Advantage altogether. The added benefits is because they're trying to get, like Rebecca said, like an overall better health experience, because people tend to, number one, use less health cost if they have a better overall experience with their health. If they're eating better, if they're able to get to their doctor's visits, things like that. If they're not stressed out, it really reduces the actual cost of health. And so that's kind of why these plans are put together the way that they are, to help.
Mm-hmm. Yeah, because when you think about ABA therapy, things like that, it gets pricey, Okay, so there was a question about how do I apply for a gray card?
I mean, I would go with, I think that again would be a little bit, individualized, and we'd be happy to, well, we never just turn anyone away if they reach out to us. We'll try to at least point you in the right direction. And again, not trying to be vague on purpose, but that's a little bit of an individualized discussion.
Okay. Well, I think that we have had a great discussion. And as always, Andrew, awesome job.
Thank you.
And Rebecca, thank you so much for your expertise, and Robert as well.